All right, joining us, the Health Minister of Kerala, Veena George. Ma'am, thanks for joining us. What is the reason for the sharp spike that we're seeing in cases in your state? Why is the test positivity rate so high?
We are doing maximum number of tests these days. Because yesterday we did more than 1,55,000 tests, and when you look at the data about 1 year ago during Onam season and the tests conducted then and the number of tests we are doing now, so we have increased the number of tests by 5 times, and also we have a specific plan for those areas where the test positivity rate is high. We do 10 times tests in those areas where we enforce micro containment measures. So, and also we are trying to identify every single case, and as per the prevalence study conducted by ICMR, we have the lowest seropositivity, which means that more than 50% of the total population is still affected, or we have more number of susceptible people in Kerala. So we have more chances are there getting the pandemic spread. So we are trying our best to contain the disease by increasing the number of tests, by identifying every single case, and also the undercounting factor in Kerala is lowest in the country. We do report every single case in 6 cases. So the national average is 1 in 33. So our undercounting factor is the lowest, and also the test per million in the state is the highest. So we are, our strategy is quite clear: testing, tracing, and we are giving treatment. And also, if you look at the hospital occupancy and ICU occupancy, you can see that the hospital occupancy and ICU occupancy is almost around 60%, which means again that the severity of the disease is comparatively less, maybe because of vaccination.
Sure. Do you think that some of the relaxations announced for Onam, for Bakrid could have led to the surge, and perhaps the government shouldn't have allowed markets to reopen since we haven't seen any easing up of the cases?
See, we are closely monitoring the situation, and our government of Kerala is dedicated to protect the lives and also the livelihood. When you look at the fatality rate, we have one of the lowest fatality rates in the country, it's around 0.5%. So, and also it has been 1 year and 8 months since the first case was reported in the country. It was reported in Kerala. The first case was reported here. So we cannot keep the people all the time shut down in their houses. So we have to protect their lives and also their livelihood. But the most important thing is that we are asking our people to have COVID-appropriate behaviors. You can see everywhere in Kerala, the people, they are wearing a mask, they are observing social distancing, and we are not allowing social gatherings with large crowds. Only less than 20 people are allowed in wedding ceremonies and also in funerals. And also, we do have DCCs, domiciliary care centers, to avoid home clustering. And we are closely monitoring the situation, and since the vulnerability or susceptibility of the state is high, again it shows the success of the protective measures so far we have adopted. So since the vulnerability or susceptibility is high, more chances are there. And also the second wave started by the middle of April, and we have always tried to drag the wave to delay the peak. So we had a peak on May 12th. On a single day, on May 12th, we had more than 43,500 cases. And then if you look at the number of cases, it went on decreasing. And we have always tried to keep the number of cases below the medical capacity threshold. Sure. And so, yeah.
Sure. But ma'am, I'm also asking, as an example to some of the other states who could be dealing with the same decisions. In retrospect, do you feel it was a mistake to prioritize festivals over COVID safety?
Sorry?
The fact that we've actually gone ahead and allowed festival celebrations over COVID safety at a time when cases were spiking, do you feel in retrospect that that was perhaps a mistake?
No, see, we didn't have any of celebrations here. People, they make sadhyas or delicious lunch and all, but no official gatherings, no celebrations, no outside celebrations were allowed. Nothing was there because During these Onam holidays, we used to have huge gatherings with lots of fun and all. But this time we didn't have anything. Not in offices also, we didn't have lunch together or anything. We just put some flowers like Atta Pokalam, and we didn't have anything. We didn't have anything else. So no such celebrations were allowed. Only thing was that the shops were open. But only those people who was vaccinated and who have undergone RT-PCR tests were allowed, and home deliveries were encouraged. And again, we are closely monitoring the situation. Yeah.
So the BJP and the Congress, just one more question, ma'am. The BJP and the Congress have been questioning the government, your government, saying that the Kerala model doesn't work and that the state government has failed to implement norms properly. How would you respond to that?
See, how can you analyze, how do you analyze, on what all parameters you can analyze the situation, how a government or a state has dealt with the pandemic or is dealing with the pandemic? You look at the fatality rate. The fatality rate of Kerala is the lowest in the country. It's 0.5. Again, you look at the undercounting factor. It's 6. It's again the lowest in the country. You look at the tests per million we do. It's the highest in the country. Why? We can say, we are not doing tests. We'll be going on like this, 30,000 tests. We can go like that. But what we are doing is that we are doing maximum tests. Why? We want to identify every single case, and we categorize the people like A, B, C, etc. Okay. That's why also the seropositivity or the seroprevalence study of ICMR, it clearly shows that. All 4 studies shows that. The latest study also shows that more than 50% of our people are unaffected, which again shows the success of our protective measures. So the fatality rate, it is the lowest. The undercounting factor, it's the lowest. The tests per million, it's the highest. So when you look at and the hospital occupancy, you cannot find a single case in Kerala where the patient died without getting oxygen or without getting a hospital bed or without getting an ICU facility or a ventilator. So we have always tried to give all the hospital care, or we have tried to keep the number of patients below the medical capacity threshold.
Okay.
Yes.
All right. Thank you so much for your time, ma'am. And then Veena George there insisting, she's the Kerala Health Minister, saying that we still have the lowest fatality rate, even in the midst of those spiraling cases when it comes to the state.